Thank you very much, Abigail, and thanks to you, Clementine, and other colleagues for facilitating this second webinar and for the practical organization. I will be your moderator and facilitator for the discussion for this 1 hour and a half. And I'd like to invite and introduce the President of the European Brain Council, Professor Suzanne Dixon, to provide introductory remarks. So Suzanne, the floor is yours. Suzanne?
Galen.
Okay.
I'm muted.
Yes.
You hear me okay?
Perfect.
Okay, great. Thanks a lot, Fred. So I'm the president of the European Brain Council. My name's Suzanne Dixon, and I'm here to, first of all, welcome you, all of you, for joining us to this second webinar of the European Brain Council-led Thematic Network, as you've heard, towards an EU coordination plan for the brain. So a few months ago, EBC has been selected to lead the DJ Santé thematic network titled Towards an EU Coordination Plan for the Brain under the EU Health Policy Platform. So within this thematic network, our primary aim is to prepare a position paper. Now, we refer to that as a joint statement, which will present the collective vision and strategic recommendations towards an EU coordination plan for the brain. So working towards this, we integrated insights from our first webinar and also from the public consultation launched in the month of October 2024. So this joint statement will provide concrete policy recommendations towards an EU coordination plan for the brain, while at the same time, it's an opportunity to socialise the notions of brain capital and brain economy and reach a consensus on how pivotal they are in addressing the current social, economic and demographic challenges and improving EU citizens' health. In the current context of increased focus on competitiveness and innovation, an overarching plan for the brain at the EU level would allow for streamlining of resources, avoiding duplication of efforts, while at the same time maximising policy impacts for the millions of Europeans living with a brain condition, but of course also their families, their carers and societies at large. So this is our agenda for today, and I'm really looking forward to it. Thank you for participating. Thank you to all our speakers and panelists, and have a great meeting. Thank you. Back to you, Fred.
Thank you very much, Suzanne. And obviously, it is an invitation to all our audience and all of you in attendance to really contribute your thoughts once again on the different issues that will be presented to you, but also, as Suzanne just mentioned, to really advance the conversation from our first event. And in order to nurture and I would say provoke thoughts in doing so, we have invited a couple of contributors to share ideas and to share their activities with us in order to advance the conversation. And the first of our contributors this afternoon is Dr. Katrin Seeher from the Brain Health Unit at the World Health Organization. And we have asked Katrin to join us to speak about the advancement of the brain health and the brain capital agenda in the context of the WHO responses to global challenges. So, Katrin, the floor is yours.
Thank you, Fred. Very good to be here with you. Greetings from Geneva, Switzerland. I'm here to provide you a little bit of context, provide background on what WHO is doing in the area of brain health. And I'm really hoping that with this broad overview, in just 10 minutes, you get an understanding of where there might be, synergies that we can use, and we're really excited to be part of this. Can we go to the next slide? So I thought we'll start with our understanding of brain health, and I know that this is a concept that is still evolving. There are a lot of conversations going on about what brain health actually is. In 2022, WHO released this position paper on brain health optimization across the life course, and there we put in this working definition. And the important part for us was that we wanted to define brain health not as a collection of neurological brain diseases, but more as a state of brain functioning across multiple domains. So that includes cognitive function, sensory function, behavioral, socio-emotional, motor function. All of these allow a person to realize their full potential over the life course. That function might change and evolve, and it will also alter in the presence or in the absence of a disease that affects the brain. But it was important for us to think of it as a spectrum, and every person could have brain health. Next slide, please. This broad concept of understanding brain health and looking at brain function doesn't ignore the fact, though, that conditions that affect the nervous system cause globally a huge amount of burden. They're the leading cause of conditions that causing disability, and also the leading cause of premature death. So what we did together with colleagues at IHME and the Global Burden of Disease Network is we tried to quantify the health loss due to conditions that affect the nervous system. So that included 37 conditions across the life course for the first time, also looking at neurodevelopmental or neurological conditions that affecting neonatals or small children. The normal traditional neurological conditions as we would think of them, but then also conditions that indirectly affect the nervous system, such as neurological complications due to diabetes, for instance. And the important link here is also that this group of conditions now included autism spectrum disorders, ADHD, so all conditions that traditionally may have been clustered under mental health conditions. So if you put them all together, we're having about 3.4 billion people worldwide who live with a condition that affects the nervous system. And the burden is predominantly located in low and middle income countries, where on the other hand, workforce and services are minimal or reduced. So that highlights for WHO the concrete and important mandate to action. If you go to the next slide, you see how we're going to address these now. And apologies for all of you who've heard other colleagues speaking about this before. But so in essence, we have at WHO two global mandates to address brain health. One, the more broader and global one, is IGAP, or the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders. And the other one is more disease specific. It's the Global Action Plan on Dementia, which is up for renewal next year. They have in common that they all propose actions for member states, for WHO as a secretariat, but then also civil society and partners to implement and improve, advance these global agendas. And they have global targets which help us for accountability. If you go to the next slide, then we're trying to address all the different aspects that would help advance the brain health agenda globally by these different technical areas or program. And they again, span the life course. So starting with maternal mental health or perinatal health to support the best possible start to life and brain development, then focusing on childhood neurodevelopment, adolescent and mental and brain health. But then there are also disease-specific programs such as for epilepsy or dementia, which is the program that I'm technically responsible for. We really try to help and work with member states and civil society in changing the health system and the delivery for better access to care. There is other technical guidance, and I believe later on we'll come back to the problem or the issues, the challenges that we're facing from translating guidance into practice. But we do have a whole range of other guidelines available for encephalitis, for meningitis, Parkinson's, and then also more broader guidelines for or recommendations for service delivery more broadly and access to medicine. And the last part that I want to highlight, but I might come back to later in the during the webinar and share more information if time permits, is working with partners on shaping and informing research agendas. I'd mentioned at the beginning, brain health is a concept that's still very fluid. There are multiple conceptualizations, and there's a lot of discussion and sparking a lot of interest. So we're also part of those conversations, and we have, for example, a blueprint for dementia research. Very recently released a preferred product characteristics for blood-based biomarkers for diagnosing Alzheimer's dementia. So these are all efforts we're undertaking in order to keep conversation going with relevant partners and stakeholders. Next slide. And in this visual, this is taken from our IGAP implementation toolkit, but it tries to summarize in one step what it actually means to provide integrated approaches to neurological disorders. And the reason I put this up here is because it shows and it visualizes that this is not the task of just one group alone, of one discipline. It requires a village, as you say. So we need to focus and tackle this at the level of policies, at the level of service and care provision across the whole continuum of care, from prevention all the way to palliative care. We need to involve all the different disciplines. We need to think about the person being born and growing old, potentially with brain health conditions, and try to deliver this as close to the community as possible. So the task is huge, but efforts like this platform also, I think, provide a great opportunity to solve this holistically. Next slide, and I think then I'm also getting already to the end of my presentation. Yes, so I wanted to just leave you with this last slide, which summarizes again the kind of work that WHO typically engages with, and how this also fits nicely with the platform and with the webinar objectives today. So on the one hand, we're engaging in leadership and advocacy. Those are the dialogues, the conversations we're having, but also we're having with member states in trying to create the awareness. And this is where the concept of brain capital, I think, might also resonate with a lot of governments, because it takes the conversation to a different level, from being a health focus to one step up. And linked to that are, for instance, investment cases for neurological disorders. I've showed you all the different technical products that we have already, but this is one of our core activities at WHO. We produce guidance, technical products, norms and standards that are then ready for member states to adapt and shape to their context. We're working with countries on the ground and at their request, which allows us to also test certain models or proof of concepts when it comes to implementing the guidance. We're monitoring what's happening with our global mandates, but then also more broadly. And the last part is really also in quintessence, the purpose of the webinar is engaging in partnerships, in the dialogues, in exchange, being up to date, transparent, sharing what is happening, and also hearing and learning from what other partners are doing. So that's really, in a nutshell, I think, to kick off this webinar. The next slide, I think, is just to say thank you for your attention, and happy to take any questions or engage in discussions with you during the webinar. Back to you, Fred. Thank you.
And thank you, Catherine, for paving the way to the discussion of this afternoon, but also for providing this insightful framework on your activities, but also how it is actually relevant to the activities that we are now running at EU level and the development of our policy ask towards a coordination plan for Europe. So what WHO has actually initiated is absolutely instrumental in that respect. And the point about the burden and the far-reaching understanding of brain disorders, but we could also potentially expand and embrace the mental health community, because the points you were making on the far-reaching implications of brain health and including mental health has really a life course impact, and is definitely the reason why we need this guidance, as you were rightfully concluding with. But I like also the way by which you emphasize the need for an integrative approach and those joint efforts. So, Catherine, you're staying with us for a discussion afterwards, but we have a discussant to open this panel discussion. So we've invited our friend and colleague Orla Galvin from EFNA, the European Federation of Neurological Associations, which Orla, you're the executive director of, and you have now the liberty to complement Catherine's insights in order to really crack the conversation. And that allows me to really emphasize to everyone in the audience to prepare your questions or already cast them in the chat, so we can take note of them and nurture the conversation and the Q&A afterwards. But for the time being, Orla, the floor is yours.
Thank you so much, Fred. And of course, board member of EBC, it's very important to our community that we do retain that position and get the opportunity to collaborate with you all. If we move ahead to the next slide, and again, even to the next slide in the interest of time, EFNA has 21 and growing member organisations. Our organisations are pan-European or international with a European cohort as well. So we represent several hundred organisations of both very rare and very common neurological conditions. As an umbrella organisation, we really try to focus on the issues that are cross-sectional across all of our member organisations. And what I'll share with you today, which is hot off the press, it was due for first release in Parliament next week, so you are getting the first look, are the preliminary results, so the top line data that we acquired from a survey we conducted over the summer. So over the summer, we anticipated maybe a reduction in the number of responses. However, we got twice the normal rate. So if we move on to the next slide, please. We had close to 4,700 responses. So at a time in the summer And the point I'm trying to make here quite clearly is that at a time in the summer when we think we get less responses, we got double the responses because the theme of the survey resonated with so many people, and that is the invisible issues of neurological conditions. And this can really be applied to what is needed from the Coordination Plan on Brain Health and to the IGAP. So just for your information, who are our respondents? They tend to be 80% female. This is with all of our surveys. And respondents could indicate whether they had one or more and what those neurological conditions were. Next slide, please. So when it comes to the invisibility and the challenges that people face, it is important to know what is important to people with a lived experience. We're all familiar with the ratio of 1 in 3 people being affected in their life course. In Europe, this is approaching 1 in 2 when it comes to neurological conditions. But day to day, what does that mean for people? When people are discussing plans and policies, what's going to actually impact a meaningful change? And we have many policies that are being addressed in Europe over the coming months. And we have many opportunities for the neurological community to have an influence on these policies and to create an excellent, patient, user-friendly coordination plan. So when we look at these results, we see the top 3 invisible physiological symptoms or issues that affect people with neurological conditions are fatigue at 61%, pain at 51%, sleep at 44%. The other major issues highlighted were cognitive issues, GI tract issues, dizziness balance issues, mental health, and sexual health. If we move on to the next slide, please. It is so important that we do take an integrated approach because employment is the top issue that people living with neurological conditions indicated as their societal impact. So we have 71% of people saying that they had to adjust their role in work or their work schedule. And of this, only 35% report that their employer was accommodating and understanding of this change. 67% indicated that their neurological condition made work life more difficult. And this comes back to the need for a greater emphasis on things like brain health plans, awareness plans, and the work of the Brain Health Mission, and really promoting the No Health Without Brain Health campaign. Next slide, please. Another area that is highlighted in the survey response is education. So we learned that 3/4 of people found that living with neurological conditions made their education more difficult. When it comes to needing that social connection and integration that would support mental health, we learned that actually for people with neurological conditions, a little over half, 54% of people, indicated that building and maintaining friendships in their learning environment was extremely difficult because of their condition. And only 17% of people indicated that teachers and lecturers were understanding. So there's a lot that we need to do with our education systems as well to improve this situation. Next slide, please. Again, linking to that mental health, that social interaction, the relationships with families and friends were affected. And it is also impacting very much the role within the family that people can play. So 36% of people were excluded from invitations to social events because of their condition. 85% then self-imposed, chose not to attend social events due to their neurological condition. Only 35% are happy to talk with family and friends about their condition. And for parents, a group that are often neglected, for parents who they themselves live with a neurological condition, they're made to feel inadequate because of it. Next slide, please. Healthcare. So this is the one that people tend to expect us to discuss. And really here, what's so important to take from this message is the issue of health literacy. You know, we think of this as something that affects many other parts of the world more so than it does Europe, but it's a huge issue here. The first point of this conversation is that for people with neurological conditions, 85% report that medical professionals did not believe them. 83% said that because they weren't taken seriously, they didn't receive appropriate treatment. However, this is not to say that this is the fault of those working in the healthcare sector. It's because of a communication issue. It's because of an understanding issue. And really, this is reflected in that the fact we have 56% of people saying they had difficulty describing their symptoms to their doctor, which then, of course, in part led to 67% of people initially being misdiagnosed. Next slide, please. Back to the financial implications. And again, we do need to talk about this because it's a huge issue for people, but it's a huge issue for society. 74% indicated that they have higher living costs because of their condition. 72% indicated that their condition had a negative impact on their income. And when we think of the practical implications, not just money in, money out, but how you can have security for yourself and for your family, we had, of those who applied for mortgages or for insurance, 37% of people were denied this because of their neurological condition. Next slide, please. Sleep is a major issue, and again, at our board meeting today, we had major discussion around sleep. Sleep, in fact, impacts your everyday function for everyone, and we actually feel that this is quite relatable to people who, yes, live with neurological conditions, but also the general population as well. So 71% of people rarely feel refreshed after sleep, 48% rarely or never get enough sleep, 40% most often get less than 6 hours, 51% tend to have a difficulty falling asleep, and 68% of people indicate their poor sleep affects their daily life and work most often or most days. Next slide, please. The big one that faces so many people and is the root cause of so many of these issues is, of course, stigma. With this survey, we learned that 41% of people indicated they experience stigma a little, while 43% indicated they experience a lot. Now, added together, this is 84%. Approximately 4 years ago, EFNA conducted a survey on stigma, and we learned that the number was 92%. This means we've had some improvement with policy and advocacy work over the years, but there is a huge room for improvement. So we have a lot more to do, but it does mean that it can be done. It does mean that we can reduce these numbers with continued efforts. So what do people living with neurological conditions believe are the root causes of why they're experiencing stigma? So 36% say that for most of what they believe is the invisible nature of the condition, the invisible nature of the symptoms cause the stigma. And what's the issue there? Communication, health literacy, understanding conditions. 25%, again, purely a lack of understanding. 18% misconceptions, myths about the condition. We need to communicate. If I'm not making this very clear, we really need to communicate more about the conditions, symptomatic profiles, and an understanding of how our brain and nervous systems work and what happens when they don't. Number 7% rather, indicate the name of the condition. You know, ask any layperson to read out a handful of neurological conditions, and it can be challenging. Many syllables, tongue twisters, and it all adds to a deep concern and stigma. And 4% simply say that it's because they're living with a neurological condition. Next slide, please. I think I'm approaching the end, and you know, it is unfortunate that we do always put the caregivers towards the end. Again, here we had a good input from parents who are caregivers to people living with neurological conditions. The other thing that many of you are already aware, but for neurological conditions are often chronic, progressive, and in some cases terminal. So 50% of caregivers indicate that due to caregiving, they can't have employment. When we looked at this in relation to women, a couple of years ago, we saw that over 7 million women are out of the labour market in Europe because of providing care. This is not only due to neurological conditions, but it's a common theme for caregivers. 62% indicate being a caregiver has a negative impact on their income, as mentioned, and only 1/3 of caregivers can actually receive caregiver benefits. 31% rarely get enough sleep, and almost half of people sleep less than 6 hours per night. Next slide, please. Oh, well, thank you for listening. I was conscious of time, so I cut some of the data short, but that's a taster of what we discovered, and it really reflects the integrated and multi-stakeholder approach that needs to be taken to improving quality of life for people living with neurological conditions. as outlined in the IGAP, and it also outlines where we need to tackle some policy issues and ensure that they are implemented. That was something else that came up. A lot of people are aware that there are policies to support them, but they're not implemented at national level. So for now, I'll leave my input at that, and thank you so much for listening.
Thank you very much, Ola. This was extremely complete, and thanks for unveiling the outcome of that survey with a sense of premiere before the official presentation in the Parliament next week. Catherine, I'd like to bring you back, because actually we have a question from Cindy, who was actually asking how the involvement of people with lived experience and let's say their testimonies, or I would say elements of information such as the one Ola just presented, would be considered or translated into practice in WHO's current and future work, and particularly in his question in the context of the plan for dementia, but I think it can be translated to the IGAP and epilepsy neurological disorders, but even other action plans such as the one on mental health.
Yeah, great question. I was thinking or waiting to be unmuted, but I could do it myself. Thank you. And just quick word to Ola. I could have listened to you for an hour longer, and I was actually quite disappointed when you got to your last slide.
That means you should come next week at the European Parliament, Catherine.
Yeah. Because also, like, on the point of the question, it is extremely powerful to hear the reflections and the feedback of people who are actually living, like whose daily life or whose reality it is to live with these conditions. Because that influence or should influence the way we're trying to implement our recommendations. So as you probably all know, guidelines or recommendations that are issued by WHO are always evidence-based. So they're very stringent and robust processes to summarizing what's the best available evidence that we have of what works, what doesn't. But owed to tradition and history, that's sometimes the voice of people who are actually living with a condition are not reflected or only slowly built into that research and evidence generation process. So at WHO concretely, we're making huge efforts in involving people with lived experience in the different consultation phases. They're included as topical or technical experts and academics are, or civil society partners. So for instance, for the development of IGAP, there were the colleagues ran specific focus groups with people from all over the world who lived with a neurological condition, on asking what are the actions that are meaningful, what should be included in IGAP. And we're using a similar approach now whenever we develop a new technical product or team. So the question was, Fred, for what do we do in dementia? In dementia, for instance, we have a standing focus group of 10 people living with dementia from around the world. At the moment, we're still limited to English, so everyone needs to be able to speak English, but we're looking into other languages that we can offer these focus groups. And together with those 10 people, we're having monthly or fortnightly calls and ask them for feedback. So if we're including a resource or a document on our knowledge sharing platform, do you think that this will have a meaningful impact on people, on people's lives? We're also including their feedback in the development of our technical products. So I've mentioned the preferred product characteristics for blood tests of Alzheimer's. So we had the same group of people asking specifically, if a blood test were to become available, what are the key considerations that you feel developers of those tests and also regulatory authorities need to keep in mind. And this is now part of a document. So we're taking baby steps. It is a huge thing for WHO, but it works brilliantly, and we're hoping really that this also is an inspiration and an incentive for others to do the same.
Thank you very much, Catherine. Ola, I'd like to turn back to you, because you concluded by saying, can't remember the words you used, but I believe it referred to the challenge by integrating or implementing the guidance as proposed in the IGAP, I guess, into national policies. Am I correct in phrasing it that way? And just wanted to invite you to elaborate a bit on that, and where you see on one side how the IGAP and other WHO initiatives could be a very important token and I would say beacon for us in Europe to work towards that implementation and the elaboration of an overarching strategy, but then also at the same time, what would be the challenges in us doing so?
So to address the first point, I will use one of the big issues that came up is that within Europe, technically speaking, there's a lot of legislation to support people living with, and I'm going to say movement disorders, but with disabilities is how this came up. And while the legislation is there and while the policy is there, and this is reflected at national level, it's not actually implemented practically. So we need to put into practice the policies that are already in place. And some of the things that we need to do, especially with this new mandate or this new wave of MEPs that we have, is reflect on what is already there, because there are policies there, but they're not implemented. And that is also a little bit the fear when it comes to IGAP, in the sense that we have this excellent tool, this excellent resource. We have the toolkit that shows and highlights what each player, what each stakeholder can do. It's the how do we do it? It's the can we show some best case examples? And I think that's how a lot of countries and a lot of communities, I know that's how a number of our member organizations learn and progress, is when they see it happening in one area or in one country, they absolutely want to replicate it in their own country. We do need the buy-in from the member states. That's something that we have to address a little bit as well. And while many of us are operating at the EU level, we can offer, for example, template letters to support our friends and colleagues working at the national level. I'm wondering, and I might be a little cheeky in saying this, if we reflect during COVID times, you know, people across the globe looked to the WHO for their guidance and further input. And maybe there could be a stronger message that comes from the WHO to the general public, as opposed to us working already in the space. So that's my cheeky ask, because I know you do absolutely tremendous work, and we are extremely grateful for it. And the other practical piece for Europe is to take advantage of the opportunities that we have. I know we were talking about brain health here. For many people living with a neurological condition, over time they are impacted by a mental health condition as well. Is to reflect on the fact that we have things like the NCD agenda. We have things like the new wave of MEPs that we can approach. We have the new SANT committee. We do need to integrate and embed the policies for brain health across all sectors of society. What I've shown here, I'm sure could be reflected for the mental health community as well. So this means education, this means employment. And it sounds so simple, but I do think an amplification of communication, of understanding of what's needed, is something that we could absolutely tackle. It wasn't on your the slides that I presented today, but for many people living with neurological conditions, they don't have biomarkers to identify their condition. So they're really reliant on being able to describe their symptomatic profile. And that is another reason that people indicated the issues around stigma, the issues around not being believed. It's because there's still not a comprehensive enough understanding of the neurological condition in terms of the scientific profile.
Mm-hmm. Thanks for that, Ola. Catherine, I'd like to invite you to comments, because I know that you and colleagues are in the process of drafting the global status report on the implementation, or let's say the kickoff of implementing the IGAP across countries or across regions. So maybe you have a word of comment to respond to Ola, and then I'll probably dive into the questions that we received into the chat.
Yeah, no, absolutely. And so the global status report will try to take stock of where we more or less at the beginning of IGAP, and then where do we need to go. On Ola, your point about the examples or seeing what could work, we're trying to reflect some of these good examples or the highlights, the spotlights in some countries. You know, it works here. It might also be translatable to another context and inspire action. This is the whole idea of our Global Dementia Observatory Knowledge Exchange platform, by trying to bring examples of what works in one context to others who might be looking for that information. But the word of caution that I also have, and this is now me critically reflecting on 8 years of dementia action plan, we always start very ambitious and come up with very robust, broad policy frameworks that try to address all the different issues that there are. And then when it comes to implementation, we're often facing that problem of you don't necessarily know where to start. You try to tackle everything because everything is important, and that overall hinders progress. So what I really like is about that idea of showcasing good examples is that they are concrete. They're trying to tackle one problem that's not going to fix the entire thing that might need addressing, but it helps, you know, address one thing, and then we can move to the next. And how our IGAP monitoring hopefully will help and support member states, but also, you know, civil society and people living with those conditions, is identifying where the biggest gaps in a given country, in a region, globally, and where do we want to invest maybe fast. And then we can use all the technical guidance and recommendations that we have on trying to implement those. But the priority setting, that stepping one step back and saying, okay, what do we need to tackle first, is extremely important.
Yeah, and in that respect, we've got a question from Arlene from Stroke Alliance for Europe. Arlene was asking, because you singled out dementia, but obviously we can talk about epilepsy as well, because it's your starting point for the development of the IGAP. But stroke is definitely one of the conditions having the biggest impact in terms of disability. Would there be any technical reports or guidance that you have produced on that particular condition? Did you get that, Catherine? Oh, okay. So it seems we've lost you. Okay, we can no longer hear you. So can you hear us, Catherine?
I shouldn't have.
Oh, lovely. You're back. Okay.
Okay, good. I'm just keeping my head still.
Okay.
Yeah, no, totally agree. Stroke is, I mean, it's the #1 contributor to neurological burden overall. You will be pleased to hear that we're including some, we're currently in the process of updating our dementia risk reduction guidelines. And previously, stroke as a risk factor was not featured in those guidelines. We now want to actually look at the same way as we're looking at treatment for hypertension or diabetes, stroke treatment, prevention of secondary strokes, and so on, in their effectiveness for reducing dementia. We don't know yet what the evidence will say. This is work in progress. But we're trying to include or tackle it that way. And then in addition, stroke is partly dealt with or being looked at in our unit at Brain Health, but then also together with the NCD colleagues under the cardiovascular diseases. So yeah, can't speak for NCD colleagues, but yeah, this is what we're doing.
No, great, I think, but obviously there is an invitation maybe to continue this conversation offline if necessary, and this is exactly the purpose of this discussion like this afternoon. Ola, similar question were coming and addressed to you in terms of the granularity of the data that you presented. Would you have a breakdown by conditions? And another question also related to whether you received any insight on the, I would say, the gender disparities in the collection of the data in terms of biological, social, and healthcare access factors affecting women and men differently.
I do have that data, and that data will be launched with the survey report. So we have a breakdown of the countries, of the conditions, of the age, and the gender. If I can speak broadly around the gender aspect, that most 80% of the respondents identify as female. This is for a couple of reasons. One being we find most often that in engaging with patient organization groups, it does tend to be females. It's a trend. It's a role. It's a traditional role, if you like, for females. We also see that from a previous survey that we have more females than males who would be interested in getting access to clinical trials and getting access to their care recipient, also for the caregivers, to have access to clinical trials. It's not to say that women are more proactive. It's maybe they're more curious about how the situations can improve. The other issue that we have is that for many of our neurological conditions that we represent, they're more prevalent in females than in males. And then that opens that can of worm for research, you know, when it comes to developing research for people living with various neurological conditions. Are treatments designed for the male body versus the female body? And we see some examples, most notably, I suppose, from Parkinson's, where some treatment is only effective 3 weeks in every 4 for women. So I do believe that women know that there are issues that could be addressed for them. You know, I don't want to say women are more solution orientated. You know, we want to try and discover this. But even before my time in EFNA, there was always that 80 to 20% ratio. I can't remember if I addressed all of the parts of your question.
I think so, yes, definitely. But you also teased beautifully for your report, so I think that most of the people in the audience will be tuned and follow the launch. We actually have a question addressing prevention, and I know it's the topic of our next talk, and I see that Professor Bourne is already online for his presentation. But before we turn to the topic, Catherine, Ola, I wanted to probably provide you some keywords, conclusion, or 30 seconds takeaway from the conversation and your interactions. And I'd like to really thank you for your contribution, because that conversation was really a really helpful one. So conclusion, who would like to start? Catherine?
Happy to, yes. I think on prevention or promotion specifically is given that for many of the neurological diseases, we don't have a cure. The best public health method or approach that we have is prevention. And when we look at our dementia figures and the country responses, and I'm sure the same will be once we're analyzing our IGAP data, is the country's not making enough use yet of the prevention potential of that promotion, starting early on and really doing it across the life course. So this is one topic that's really, really important, and I hope we can build on and yeah, collaborate on in the future.
Thank you, Catherine. Ola?
In the interest of time, I completely agree with Catherine. I think we need to absolutely leverage, support, utilize, share and disseminate the work that has already been done, for example, by the IGAP or by the WHO with the IGAP and with the IGAP toolkit, and then to support the campaigns and work that are ongoing with EBC, with the No Health Without Brain Health campaign, with the EAN, with the Brain Health Mission. And final time I'm going to say this today is to communicate more in a better understanding and improve health literacy in the area of neurology.
Thank you, Ola, and thank you to the two of you for this contribution. And as we were hinting to, the conversation is ongoing and should be continued, and we are quite happy to continue to nurture it as we go and as we move ahead. As anticipated, I'd like to now move forward to our next speaker, Professor Paul Bohn, who is the past president of the European Academy of Neurology, and who has kindly agreed to join us this afternoon to address the topic from burden to breakthrough, advancing brain health and brain capital in the European Union. Paul, it's a pleasure to have you with us, and I'm quite happy to give you the floor. Over to you. Paul, you're muted. Perfect. Yes. Yep. Over to you.
Now you should be able to hear me. Thank you. Thank you very much, Mr. Chairman. Fred, thank you so much. Thank you to the organizers for having invited me. I'm the humble servant of the organization that is called the European Academy of Neurology. We do represent in 48 different nations in the European WHO space the neurological profession. So thank you. We fully appreciate the invitation, and I would like to take the next 10 minutes to show you a bit what we think and what we know is the burden of neurological disorders, and with one purpose: to improve the lives of our patients and their relatives. And in that perspective, more attention for neurological burden and more attention for the advancement of brain health and brain capital in the European Union is very important. Do I have control over my own slides? I think so. No. Can you move to the next slide, please? Because I do not. Oh, do I have control? Oh, yes. Thank you. So in order to fill a gap, and on the one hand, and at the same time trying to build synergies with all initiatives that have already been taken, EAN has incorporated the Brain Health Mission. Now, what is the Brain Health Mission? It is intended to be the most inclusive and most collaborative initiative with a large number of strategic partners, on which I will come back in a second, with a purpose of enhancing the public understanding of brain health across the entire lifespan. The idea is not only to talk preventive measures, but to talk about specific preventive measures. And the purpose, as I said, is to decrease the incidence, the burden, the prevalence of neurological disorders. What we really want is obviously allow every individual, every European citizen to pursue brain health according to the definition of WHO. These are our strategic partners. The number has been consistently growing over the recent months. But what is now the purpose? Let me briefly take you through aims and goals. First of all, we want to ensure that there is a basic understanding of brain health and how to optimize it available to the general public. I've been saying this many times, but we believe that school children have a general understanding of dental health. They know that they need to brush their teeth. This is being taught at home. It is being retaught in primary school. And we would think, or we believe, that many children in Europe, the majority, have an idea about what dental health is, and they take that idea and that knowledge through adulthood. Well, the same is not true for brain health. I mean, people have no idea about what brain health is. People who are healthy, because brain health obviously does not address specifically to patients. It does address patients, but mainly non-patients. People have no idea about brain health unless something terrible happens and they become neurologically ill. So we strive at a more general understanding and awareness about what brain health truly is. We want to support, secondly, and disseminate public health strategies which will make an important and meaningful long-term impact on brain health of the community. And thirdly, we want to boost the workforce of healthcare professionals within neurology, because there is an issue. And let me just take you to the issue. This infographics shows the issue, and it's grossly underestimated, underappreciated, and undervalued. According to the most recent data of the IHMA, 43% of the overall burden of disease is of neurological nature. So we are not talking about non-communicable diseases. We are not talking about mental disorders. We are talking just about neurological disorders. It is indeed, as has been previously mentioned by Orla, the main driver of disability globally, and neurological disorders are among the largest contributors to DALYs in the European Union. What about the workforce? The ideal number is somewhere between 1 in 15,000, 1 in 20,000 neurologists. We're now at one neurologist per 100,000. And this is in high-income countries. So the situation is far worse in areas of Europe, of the European space, that are a bit underprivileged. And it's obviously much worse in other parts of the world. But let's now focus on Europe. What about costs? Well, the costs are staggering. The costs of neurological disorders are more than the sum of the costs of diabetes, cardiovascular diseases, and cancer. And this does not show based on the public expenditure and the spending of governments and this public spending on neurological disorders and neurological research. The slide that I'm showing you now gives you the precise data. I will not elaborate on this much longer, but just to give you a few data. In 2021, 43% of the global burden of disease is neurological in nature, which is equivalent to more than 10 million deaths, 168 million years lived with disability, many millions of years of life lost, and, well, a staggering figure of DALYs. What about costs? It's too early to give you all the details, but we are really finalizing this major study now. On the initiative of EAN, we have done a cost of illness in neurology in Europe study, the so-called COIN Euro. The general manuscript is about to be finished and will be submitted to a major high-impact journal soon. And we are now in 2019, based on the situation of 2019, at a cost of more than 2 trillion. And this encompasses the WH Europe region. So this is absolutely staggering. It's not only a matter of expenditure, it's even bigger. The brain capital, which we believe is, well, the potential of the brains of our citizens, being the main resource of all countries, including the countries who have many natural resources, but this is even more true for countries that do not have many or have no natural resources at all. It is basically the brains of the citizens that are the main resource. And we should really think in a post-industrial era about this in a much more systematic way. Protecting the brains of our citizens from early life on is an essential economic, how should I say, duty. And it's a duty of governments, really. It's a duty of those people who are leading society. What do we know about individual brain health and what are the preventive and determining factors? I'm just taking you very quickly, for the sake of time, through this slide. Well, let me just start first.
Paul, just to intervene, we have a bit of time, so really.
Okay, I don't have to rush. Okay, fine.
No. Take a bit of time if you would like to cover that, because I think it's an important one.
Thank you. Thank you, Fred, for giving me that opportunity. Well, the model that we are trying to disseminate is a 3-layer model, which are in terms of determinants of brain health, which are first, which are the immediate actions that individuals can do for their brain health? Well, and many are known. I mean, it has to do with mental activity, having enough and good quality sleep, is taking care of your food intake, having enough and meaningful social interactions, enough physical activity. These are things that are well known. This really is not the challenge. And it brings me to a very important point. Prevention is obviously key, and it was mentioned just before that, we should spend more in prevention because, as has been said, many neurological disorders are untreatable. I would defy that point. I mean, if we would spend more money, many more neurological diseases would become treatable, and prevention would be a different thing. So we have to do both, as a matter of fact. Obviously, if we can prevent, typically prevention is cheaper than taking care of illness. So there's no question about that. But I mean, it's not saying that, well, prevention is fine. We do cardiovascular prevention, and what is good for the heart is good for the brain. This really is beside the point. It's completely missing the point. What we really need is massive investment, and it has also been said, and I thank Orla for bringing it up, biomarkers. For many neurological diseases, in the meantime, we have biomarkers, but for others, we do not have biomarkers. If we would invest much more in neurological disorders, an amount of money relative or in relation in line with the massive burden, then we would have biomarkers by now. So we should be careful not to get into circular reasoning here. To continue the individual actions that can be done on an intermediate basis to protect our brain health. Well, you can basically see, I don't have to call everything, but I mean, avoid excessive alcohol, make sure that eyesight is fine, that hearing is fine, that cardiovascular health is okay. That patients are being vaccinated, that preventive measures are done, all very important, cholesterol, and so on and so on. Fine, many of these things are known, but not enough. And then the last point, a bit on a higher level of abstraction, I would say, these are the external factors. And you can read for yourself. I would say that given the current conditions in Europe, probably one of the most important and neglected factors preventing people from feeling healthy in their brains is war. So, I mean, a peaceful society, a society that takes care of their citizens, is probably the most important condition to be achieved in order to keep the brains of the citizens healthy. That being said, and I'm looking at the entire audience, but more specifically to the policymakers here, what on behalf of the people who work with neurological patients on a daily basis throughout Europe, and we are talking about 45,000 professional doctors working with the brains of people, what are our asks in terms of policies? Well, first of all, and let me start with the last point, please pay more urgency, pay more attention to the need to address neurological disorders in their own right. Our patients, and I'm fully aware of the somewhat controversial nature of what I'm going to say, but putting and keeping neurological disorders in the basket of non-communicable diseases is hurting neurological patients. it is likely that this will delay the, or it will delay the, how should I say, the lightening of the burden, because it is not doing the right to the neurological patients. The spending is just not enough and completely not in line with the relative burden of this type of diseases. While we obviously acknowledge that most neurological diseases are non-communicable diseases, but certainly not all, the other major confusion is that by thinking that you invest in mental health, you solve the problem of neurological patients. That is not true. We fully acknowledge that the main comorbid disorder of neurological disorder may be mental disorders and vice versa, by the way. So there is a considerable overlap. My point is that we should see neurological disorder as a separate entity. And this is a long-term shot. We are fully aware of that, but it should be in a separate category in terms of policy making, in terms of research spending, in terms of the way politicians at the European level look at us. This is absolutely necessary. We realize that cannot be achieved in a short term, but it should be considered on the longer term. It is the most direct way to decrease the burden of neurological disease for patients. Secondly, and more concretely, we are very much in favor of creating a European Parliamentary Intergroup on brain health, not on mental disorders in itself, but preferably on brain health, to serve as a platform to foster our collaborations. It has been rightfully said so far that many initiatives are taken. And I mean, if you look at the audience that is here, all the stakeholders are really present. And I think we really should work together much more and much more closely. And that is why we need this EP intergroup on brain health. And last but not least, a coordination plan on the European Union level for the brain is absolutely necessary. What we can offer as a neurological community is our very strong link with 48 different national neurological societies. We have been, let's say, differentially successful in doing so. We work together in terms of IGAP implementation with the local chapters of the International League Against Epilepsy, very closely together with the patient organizations. I think this is a way in which the neurological community, and also building on the strength of the European Academy of Neurology and the Brain Health Mission, in which we can actively contribute to fostering and improving the lives of our neurological patients. Thank you very much.
Thank you very much, Paul. Thank you for this very vibrant call for action, but also for providing this level of evidence in supporting this policy ask. And obviously, yeah, the final slide is also a very interesting token of EAN Brain Health Summit of this year, and where you had high-level participation. Maybe you'd like to say a word about that.
Well, yes, I was a bit pressed in the idea that I had much less time than I thought. So thank you for again. It's usually, this is not my typical situation where the chairman gives me more time. I usually am stopped by the chairman because
and I understand how surprising this could be. Yes, indeed.
Well, no, I had a couple of slides just showing a few examples to the audience of what we have done just recently, and in a very, how should I say, an éventail of different activities, reaching specifically or trying to reach high-level decision-making levels on the one hand, and working with students on the other hand. Let me just briefly explain. What EAN has done in the last couple of years is using, or at the occasion, or using the opportunity of the rotating presidency of the European Council, that is to organize a European Brain Health Summit every 6 months. The last one was in May of this year during the Belgian presidency, and we were very much honored by the acceptance of Her Majesty Queen Mathilde of the Belgians to come and support our cause, and she did so in front of an audience of a few hundred people, both physically present and online. We had high-level presence from European Parliament members as well. And the idea was really to bring together a large number of stakeholders in the Brain Health Mission. Maybe the next slide gives you, again, a high-level meeting in the context of the European Health Forum in Gastein, a very well-established initiative in Austria, where we, again, with very nice moderation of EBC and Fred Desterbeck, giving the opportunity to the leaders of the European Academy of Neurology and the Brain Health Mission and other stakeholders to discuss a more holistic approach to both neurological and mental health. This was a very successful initiative as well. I thought I had, well, let me just I had another slide. It has disappeared strangely. Just very quickly, I discussed the children, school children, about and their commitment and involvement in dental health. Well, we have now both in Finland and in Austria launched initiatives where school children of primary school age are invited to think about their brain and brain health and do fun activities related to brain health with a contest that is then and then the winner of the contest is being celebrated and feted in a nice environment. These are activities that really raise awareness and have an amplification effect on all the other awareness activities that we do. Last but not least, the Brain Health Mission. I've tried to explain you in short what we do, what we aim. We're very open. Anybody who wishes to contribute to our mission is very welcome to join. And let me just invite you to the next European Brain Health Summit, which will take place in Brussels on March the 19th, 2025. And now, Mr. Chairman, this is the final end of my formal talk, and I'm obviously very eager and happy to answer any question. Thank you.
Thank you very much, Paul. And I'm quite happy, to leave the space for promotional messages as well. So we will be disseminating the news about the summit in March, indeed. There was a question about how to transform the gamut of information into let's say a more concrete brain health strategy, which is obviously the topic of the webinar. And I simply would like to follow very quickly with the outcome of the survey that was run towards the audience and the stakeholder community that is active within the EU health policy platform. I don't know if the couple of slides that we have prepared can be shown, and after that we can have a very, very short Q&A. But the idea was really to try and remind the timeline, which is on this slide. So obviously today's discussion builds on the previous opportunities of engagement that we have had, as Susan Dixon was saying in her introduction, but the final outcome is for us as all participants and contributors to be able to finalize this proposal for a coordination plan on the 26th of November in Luxembourg at the final conference of the health policy partnership. So the consultation that was run gathered 128 responses, as you can see, from 27 countries, and it was mainly made on behalf of organizations or individuals' responses. And here is what it said. So the need for action was definitely shared. I won't go back on what both Paul, Catherine, and Ola said this afternoon, but there is definitely a need for action, but there is also a feeling that current policies should be improved in order to address the personal, societal, and economic challenges represented by brain disorders in society. And a reminding element in terms of the burden of disease. So this is really the capture of what mental health disorders and neurological disorders do represent for society in terms of disability adjusted life years. You can see that the trend is really staggering towards 2050, but you can also see that the share between mental disorders in blue, neurological diseases in orange, and stroke in purple actually do represent for society, then reinforcing the urgency for action once again. Here we had questions relating to the amount of funding and whether they would be seen as being commensurate to addressing those challenges. And we can definitely conclude, and this is your contribution, that the current level of funding is suboptimal in order to address those challenges. I'd like now to turn to a point that was addressed in the former discussion and that was alluded to by our speakers this afternoon, the notion of brain capital. So looking at our brains as more than an organ that would actually dysfunction in its development. So really seeing as our brains as an asset to society. And I will leap immediately towards the question that was asked in the survey, whether brain capital is seen as important and crucial to socioeconomic stability. And we can see here that it is an overwhelming support to this question. So, which is leading us to the way by which we can leverage those elements towards the need for action and the potential and the opportunity for growth. I won't go back to what Catherine presented to us with the WHO action. I will not elaborate any further either on the momentum at the national level in the context of implementing the WHO Global Action Plan, but maybe concentrate on the different EU initiatives that currently exist. I must admit that we were quite surprised to see the results of the question we asked in the relation of the awareness and the knowledge on those different initiatives, whether it is related to the Healthier Together, the approach on mental health, or the Brain Health Partnership, the joint programming on neurodegenerative diseases, EBRA, or Horizon Europe. Horizon Europe standing out maybe as being the better known initiative at EU level, and maybe this is something we will need to integrate in our further action in the design of the coordination plan. Just a concluding word on two last questions in relation to the barriers to achieving a brain positive economy. I mean, the figures speaks for themselves. The issue of funding, the issue of awareness, policy implementation, but as Professor Bone was also alluding to, brain health education being one of the key features that ought to be promoted in that respect, and a greater degree and a need for greater coordination to address fragmentation was definitely another issue that was singled out. In view of the implementation of a comprehensive strategy, issues of funding surfaced as being the number one issue again. Political will and leadership, and again, the fight against fragmentation would be seen as key priorities. I'm really sorry to really rush you through the outcome of this survey, but for the sake of time, I really wanted to invite the delegates and the representatives from DG Research and DG Connect who are in the audience to also have an opportunity to take the floor in order to maybe discuss some of these findings, but also some of the elements that were mentioned in the discussion. And I simply would like to reemphasize the momentum we are in at the moment to try and capture all your views and all your comments. It is still time for you to be in touch via the platform of DG Santé and enable us to provide this outcome by the 26th of November. And I'll pause here maybe to allow Alina and Tim, if you'd like to take the floor now. Tim?
Yeah, if that's okay for you.
Yeah, sure. So Tim, if I introduce you, so Policy Officer, DG RTD, DG Research and Innovation, Tim Ramakers. A pleasure to have you as always, Tim. So please.
Yeah, thanks, Fred. Yeah, apologies for not joining from the very beginning because I was stuck in another meeting. But in fact, yeah, I'd like to just go back actually to the presentation of Paul Bohn. Okay, there's a lot of emphasis on splitting the two areas of neurological, let's say, health and mental health. And okay, I understand, from the point of view of funding, maybe it's beneficial that way, but surely from a biological point and to gain a better understanding of disorders, and without putting directly a label of it being, some specific neurological or mental disorder, it sounds to me that a more holistic approach should lead to a better understanding and better treatments and better care and better diagnostics. And that's why also that we are on the process of developing this European partnership on brain health. And brain health here covers the whole area. It follows the WHO definition, but it includes mental health too. And I'd just like to know your views on this.
Yeah, thanks, Tim. Abigail, Clementine, is there a way by which we can have Professor Bohn together with us on the screen? And Paul, please, over to you. Oh, Paul, you're muted. Paul. Yes, perfect.
I cannot unmute myself, but I see I'm unmuted now. Thank you.
And we can hear you now. Yes.
Yeah, thank you very much. Well, Tim, thank you very much for asking that question. It is a most frequently asked question. Please do not misunderstand me. The statement is not aimed to fragment. The statement of making neurological disorders more visible from a policy point of view is only justified by the fact of the huge discrepancy between the incredible high burden and the relatively low expenditure, which is not the case for mental disorders. I mean, if you look, and there is data from different European countries, including this small country as ours, Belgium, where there is actually the only field that is still growing in terms of expenditure is the psychiatric field, is mental disorder field, while neurological disorders being trashed in the basket of non-communicable diseases is not receiving extra funding. So this is why I'm claiming and I'm saying that. The key point, however, is, and there we are teaming up with mental disorders, the field of mental disorders and neurological disorders. It would be fantastic not to be anymore in the basket of non-communicable diseases. That is the key policy question. The other question is mainly regarding funding. And I can only repeat my claim that by putting everything together, we are hurting a large number, or at least delaying more funding and more attention and more awareness to a large number of patients that incur a huge dramatic cost. That is the point. Nothing less and nothing more.
Yeah, okay, I get your point. Yeah, it's my view, or my comment would be more. I get your point. It's just it gets confusing for people out there. What is brain health? And actually, maybe we're not at that definition yet.
Well, I'm not so sure it's confusing. I think the WHO did a fantastic job defining an operational definition of brain health, which truly encompasses both neurological and psychiatric aspects, referring to the old saying, mens sana in corpore sano, I mean, the brain and the mental status and the neurological status are obviously managed by the same organ. That is clear from the beginning. However, the burden is different. The burden is different. The clinical perspective is different. The societal aspects of psychiatric disorders, mental disorders on the one hand, and neurological disorders are really different. So there is many reasons to keep that separate while we can team up. I personally see, and this is also the belief I believe within the neurological community in Europe, that we have much interest in teaming up together with people who care about mental patients who have mental disorders. So there is no desire to split. The only desire is to be more visible.
Mm-hmm. So, Tim, actually, on the definition of brain health, I know that DGRTD had a similar approach in the way the brain health definition was designed in view of the creation of the partnership, and know that we are obviously busy with the preparation of it. This inclusive approach was also, let's say, very much aligned with your understanding, or let's say the vision that you are now spurring within the Commission, right?
Sorry, Fred, I didn't get the question for me.
No, yes, that the understanding of brain health in the context of designing the brain health partnership is a very inclusive one, and
Yes,
actually
that's
builds
right.
on what Paul was just saying, and is inclusive of mental health, as you rightly pointed out.
Yes, exactly. I mean, yeah, okay, it doesn't, maybe it takes away some visibility, but it certainly, yeah, it should lead to a better understanding and a better approaches to better strategies for care and treatment and yeah, diagnosis.
Yep.
Can I just add something more, if you allow me, Fred?
Very shortly, because we are hitting the end time. Yes.
Just consider the metaphor of two sides of a coin. It is as simple as that. We're talking about one piece of money. It's two sides of a coin, and they're intrinsically linked, but very different. I mean, the one side of the coin will make the game very different from the other side of the coin. And the last point that I wanted to make, just to illustrate the actuality of what I'm saying, in the results of the survey that Fred was showing, it said, you know, mental disorders, neurological disorders, and stroke. I nearly fell off my chair. Stroke, by my understanding, is a neurological disorder. It's not a cardiovascular disorder. This is what WHO, ICD, and all the authoritative bodies have said. So it is no criticism, but I'm just seeing that. I saw that at American meetings before. Really, I mean, we have all this is just the point. By being in this basket of non-communicable diseases, this incredible confusion remains about stroke being a vascular disorder or cardiovascular disorder and not a neurological disorder.
Yeah. Thank you, Paul. And with your metaphor, now I understand why the acronym of the cost of illness in neurology is coming from. So,
coin. Yes.
Tim, would you like to have a last word of conclusion, because we are now finishing with a bit of delay, but I don't know if there was anything else you wanted to contribute to the discussion this afternoon.
Yeah, well, I mean, I have many questions, but I mean, yeah, it's just impossible to cover it all, and the you know, taking a brain capital into the equation is super important, and yeah, we need to see it, you know, certainly in these times now with the new political context and the European competitiveness and innovation. Yeah, there's a lot to do in all areas, you know, brain health, brain capital. So yeah, let's see what the future will bring, and certainly in these in areas also defined in the political guidelines. So there will be there's a lot of momentum, let's say, and I think that's great. Yeah.
Yeah, that's great, and thank you for your support, Tim, and for the collaboration so far. And we look forward to, you know, every single step that we can do together. And obviously, the work within the policy platform is really instrumental in advancing this agenda, and we are quite pleased to be able to rely on your support in doing so. So thanks again for that, and please do keep all your questions, because we'd like to continue the conversation, obviously, and not leave it and forget it today. But just for the sake of time, I'd like to maybe invite our chair and president of EBC, Suzanne, maybe to provide a word of conclusion. Oh, here you are. Magically, you appear. Over to you, Suzanne.
Oh, thanks so much, Fred. Wow, we would need at least a couple of hours more to go through all the topics we've been discussing. I'm here just really to say a huge thank you to all of the panelists, to Karen Sear from WHO, who's explaining the integrated approaches to tackling brain health and disorders at many levels. Orla from EFNA, her recent survey, super interesting, outlining the experience and impact on patients and carers. Paul Boone, EAN, who outlined the brain health mission as giving a passionate call for action and policy asks on the need for recognition of the burden at political level and the need for coordination at the EU level, including via IGAP. And Tim Raymakers from DG RTD, thank you very much for joining us right at the end there, raising the issues on a holistic approach. It's been super. I want to thank Abigail and the EU HPP team and also the EBC team in the background, of course, Hugo and the other members of staff, and Fred, as always, for bringing the discussions together in a really constructive manner, for outlining the consultation process that's happened on the Brain Health Partnership and the momentum that's building there. And I just want to thank all the audience also. Your support and collaboration are crucial to work towards positioning brain health at the forefront of EU policy, health, social and research policy orientations. And together, you know, we can really impact, have lasting impact on brain health, and therefore work towards improving the well-being of those billions of people that we've heard about in Europe that are suffering as a result of brain disorders. So thank you, and I wish you a nice day and evening. Thank you very much, everybody.
Bye-bye.
Bye-bye. Thank you.